Alright, so today we're going to run through first aid for a new skin tear using your home support worker first aid kit. So I'm just going to do a visual of it so it helps with you. So you can see Jen here has got a skin tear. You can see that there is a bit of a flap and all this is a bit raw. So first off, we want to control the bleeding. So you're going to do your hand hygiene, put on a pair of gloves, and you're just going to put a damp cloth over that to control the bleeding. As you can see, because there is a bit of a flap there, but there's still a bit of raw skin, this is a skin tear type 2. You'll need that for your documentation. Okay, so we're going to start. We've done the control bleeding. We're all ready to go. So first thing we have to do is we're going to do our hands again because we've cleaned our hands, put our gloves on to control the bleeding, and then we've thrown those gloves, discarded those gloves. So we're now doing our hand hygiene again. We're going to get our waste bag ready, so you can put your waste into it. We're going to get out the contents of the kit and lay them out. Just place that over there. So we've got the dressing, which is an adhesive waterproof foam dressing, and we're checking the date, so it's the 8th 2027, so that's fine. We've got our dressing pack, and again we're checking dates on it, and it's the 3rd 2028, so that's fine. We've got our wooden applicator cotton tips. That's to help put the flap back down if we need to. And again, we check the date, the 7th, 27. And we have our normal saline. And again, we will check the date and November 24. Okay. So we've checked our date on everything, and we're going to now open everything up and get it ready to go. First thing is our dressing pack. You can see there's the arrows, so you tear across the top and just pop that to one side. Okay, so tear and open to the left, so you just pull it and you open these up. Then you can see you've got 2 tabs at the top, so open that way and then pull this down, and now you've got a nice clean sterile field. So you grab your forceps and you set your tray up a bit. I take the swabs out. Okay, I've handled this edge of these forceps, so they're now no longer clean, but the tips are. So I'm just going to lay that to the side and keep the tips clean. Get out your normal saline. I'm just going to tear the corner and just pour some saline into there, and then we're just going to put that aside. Be careful it doesn't drip everywhere. The next thing we're going to get out is we're going to get our cotton tips. You can just open the flap like that, pull them open like that, and then just place them on. So we're not touching anything on that field. Throw your rubbish in there. Next thing is the dressing. Okay, again, just peel it open, and I peel them open very carefully and then just lay them to the side. So that's the top that's now exposed, but underneath is still sitting on a sterile piece of cover, so that's still sterile. Okay, so now we're going to do our hand hygiene again. Okay, and we're going to don our gloves. We're going to use what's called a non-touch technique as much as possible. If I can get my gloves on. Okay, so with a non-touch technique, we're using forceps. We just pick one of these up and pop it in and put a bit of saline on. Now you've already controlled the bleeding, so this is basically just to clean it up a bit. So we're squeezing most of the moisture out of that without touching it. And we're just going to clean, going in line with the flap. Make sure we're not moving that flap around, and push away. Put it in your wastebasket. Okay, again, the tips are clean, so I can lay that like that. If you need to, you can pick up one of these applicators, just damp a bit. If the flap's not in place, you can just gently roll it and push it, and just be very gentle with it and put it back into position. Okay, and you can pick your faucets up again, get a dry piece of gauze, and just dry the area. And then discard. Okay, so we note that the flap, this end of the wound is open, so the flap is pointing in that direction. So we're going to pick up our pen and we're going to write today's date, and we're going to put an arrow for removal. Okay. Alright, so we're ready to put on our dressing. So we just flick it over and we take off 1/2 of the dressing and discard it. Make sure you've got your arrow pointing in the right direction. So we just put part of it down, take off the other half and just gently put in place and ensure the edges are down. Okay, we check the dressing, it's all good. So we put all our rubbish in together. Make it into a nice little pack. Put it into the waste bin. Remove our gloves. Now you ask client permission to put this into their bin. If they are not happy for you to do so, take it away with you and dispose of it as soon as possible. Perform hand hygiene again. Okay, and before you leave, just check that the client's okay and it feels comfortable, and just check that there's no issue with the dressing. Next thing you do is you do your folio, you do an incident in folio, you document in Sandway, and ring your team leader if needed. Okay, thank you.